Hi, Dr. Z here. Today I'm going to be discussing why a comprehensive thyroid panel is important and breaking down these labs to show their unique roles in thyroid evaluation. As an ND, I always want to help educate and empower patients because I believe knowing these markers and feeling comfortable and confident to ask your doctors for what you need is crucial for the health and well-being of patients. The thyroid gland is such a vital part of human metabolism and regulates functions related to energy production, activating the nervous system, digestion, temperature control, and much more. It is more common for women to have an underactive thyroid, which is called hypothyroidism, but men are also affected. The autoimmune cause of hypothyroidism is called Hashimoto's disease, which is the most common form of hypothyroidism. When the thyroid gland is overworking, it's called hyperthyroidism. The autoimmune form is called Graves' disease and results when antibodies overstimulate the thyroid gland. As common as these problems are, they continue to go undiagnosed and often do not get treated properly because a comprehensive workup is not part of the mainstream thyroid testing. Typically, doctors are only checking the TSH, which stands for thyroid stimulating hormone. This hormone actually does not check your thyroid hormone, but is a hormone coming from the pituitary gland in the brain. The TSH has the job of telling the thyroid gland to make T4, otherwise known as thyroxine, and T3, otherwise known as triiodothyronine. It is often wrongfully assumed that a normal TSH means the downstream products T4 and T3 are also going to be normal. Sometimes doctors will order a TSH with reflex to T4, meaning that the T4 will only be checked as a follow-up if the TSH is not normal. The problem with only running TSH not only is that it can miss potential downstream products like T4 and T3 that could be out of range, but also there's controversy regarding what a normal range for TSH even is. While most labs consider the upper range to be between 4 and 5, integrative and functional medicine doctors often find that patients feel better when the TSH is below 2.5. Ultimately, finding the number that feels good for the patient is based off of their TSH result, other thyroid markers like T4 and T3, and the symptoms they are experiencing. Testing T3 is important because it is the active form of thyroid hormone produced after T4 is produced. T4 and T3 both get made in the thyroid gland in response to the TSH and are then sent out into the blood to do the work the body needs them to do. The labs T4 and T3 are ran because the T4 and T3 leaving the thyroid gland will travel bound to proteins in the blood. The free components, T4 and T3, however, measure the unbound forms, thus representing the amounts that are free to do work in the body. The laboratory relationship between T4 and T3 is also important to assess because someone could have a normal TSH, a normal free T4, but have a low free T3. This can indicate that there's a conversion problem from the inactive T4 hormone to the active T3 thyroid hormone. Further, normal TSH, normal free T4, and a high free T3 can indicate there is a cellular resistance to the free T3, causing it to build up and not be received and used by the cells. This can still make someone feel and display symptoms of hypothyroidism, even if they would have been deemed in the clear and normal by conventional standards. Testing thyroid antibodies are utilized to diagnose autoimmune conditions such as Hashimoto's hypothyroidism and Graves' autoimmune hyperthyroidism. Since hypothyroidism is more common, the antibodies called thyroid peroxidase antibodies, or TPO antibodies, and thyroglobulin antibodies, or TG antibodies, are used to screen for this condition. Less commonly, thyroid-stimulating immunoglobulins are used to rule out Graves' autoimmune hyperthyroidism. In short, in individuals displaying signs and symptoms of hypothyroidism, testing TSH, free T4, free T3, along with the antibodies TPO and TG is important to fully assess where the cause of the deficiency lies. If labs return showing that hypothyroidism is evident, a doctor may want to dig deeper and run additional testing for nutrient deficiencies or underlying gastrointestinal contributions. I hope that was informative and helped you understand thyroid labs a little better. But in case it was confusing, feel free to bring your labs in, schedule a consult, and have one of our experts go over them with you. Until next time, be well.